The power and danger of desperation. When faced with a dire diagnosis, the temptation to try unapproved experimental treatments can be strong. This underscores the emotional and rational challenges patients face when seeking cures. Imagine a doctor facing a terrifying enemy, cancer. It's a battle that many have fought, but few have won. According to Nature Journal, Halassy had breast cancer at the site of a previous mastectomy, a surgical procedure to remove all or part of one or both breasts. It was the second recurrence there since her left breast had been removed. The virologist at the University of Zagreb had then decided to take matters into her own hands with an unproven treatment. But this doctor, Dr. Beata Halassy, had a secret weapon up her sleeve, something that set her apart from the rest. She was a virologist, an expert in viruses, those tiny entities that can wreak havoc on our bodies. These tiny things can make us sick, but Dr. Halassy knew they could also be harnessed to fight disease, even something as formidable as cancer. This is the story of how she used her extensive knowledge and expertise to treat her own cancer with viruses, turning the tables on the disease. Dr. Halassy's decision was both brave and unconventional, a true testament to her pioneering spirit. She knew the risks involved, but she also had a deep belief in the potential of her groundbreaking approach. This wasn't just about treating her own cancer. It was about exploring a new frontier in medicine, one that could change the way we think about treatment. Her story shows us that sometimes the smallest things can make the biggest difference, altering the course of medical history. And sometimes, taking a calculated risk can lead to incredible breakthroughs, opening doors to new possibilities. But as we'll see, it's crucial to remember the importance of professional medical guidance and thorough research in such groundbreaking situations. According to Nature, Halassy's oncologists agreed to monitor her during the self-treatment, so that she would be able to switch to conventional chemotherapy if things went wrong. Viruses are tiny, like microscopic ninjas. They can make us sick by invading our cells and making copies of themselves. Think of the common cold or the flu. But here's the twist. Some viruses can be trained to attack cancer cells, leaving healthy cells alone. That's what oncolytic virotherapy is all about. Imagine a virus that acts like a guided missile, programmed to seek and destroy cancer cells. That's the basic idea behind this innovative approach. It's like turning the enemy's weapon against them. These viruses are like tiny warriors, fighting cancer from the inside out. It's a new and exciting field of medicine, and Dr. Halassy was at the forefront of it. Dr. Halassy's lab wasn't your typical doctor's office. It was a place where viruses were studied, understood, and manipulated for good. She spent years researching and experimenting with different viruses, searching for the perfect candidate to fight cancer. Her work was meticulous and demanding. It required a deep understanding of both viruses and cancer. But Dr. Halassy was driven by a powerful motivation to find a cure, not just for herself, but for countless others. Her lab became a battleground where she waged war against cancer, armed with her knowledge and her tiny but mighty viral allies. It was a testament to her dedication and her belief in the power of science. Section 4. A risky gamble. The stakes of self-treatment. Deciding to treat herself with viruses was a huge risk, one that could have far-reaching consequences. Dr. Halassy knew that things could go wrong, and the stakes were incredibly high. There was the possibility of severe side effects, ranging from mild discomfort to life-threatening reactions, and the treatment might not even work, leaving her in a worse condition than before. But she carefully weighed the risks against the potential benefits, considering every possible outcome. She was her own test subject, closely monitoring her health and adjusting the treatment as needed, with meticulous attention to detail. It was a bold move, one that required immense courage and conviction. But it was driven by her unwavering belief in her research and her determination to beat cancer, no matter the cost. She was determined to find a cure, not just for herself, but for countless others suffering from the disease. This was not a decision to be taken lightly, and it involved a great deal of thought and consultation. It's crucial to emphasize that self-treatment, especially with something as complex as virotherapy, should never be attempted without professional medical guidance and thorough understanding of the risks involved. Always seek professional advice and support when dealing with serious health conditions. Section 5. Please like the video and subscribe to our channel. Victory against the odds, a story of hope and caution. Dr. Halassy's story is one of courage, innovation, and the incredible potential of science. Her journey is a testament to the relentless pursuit of knowledge and the human spirit's resilience. Against all odds, her self-treatment was successful. This remarkable achievement was not just a personal victory, but a significant milestone in medical research. The viruses did their job, attacking the cancer cells and sending them into retreat. This innovative approach showcased the potential of oncolytic virotherapy in combating cancer. Her story offers a beacon of hope for cancer patients worldwide. It serves as a reminder that breakthroughs in science can lead to life-changing treatments. But it's important to remember that her case was unique. Each patient's situation is different, and what worked for her may not work for others. She was an expert in virology, and her self-treatment was carefully planned and monitored. Her extensive knowledge and experience played a crucial role in her success. Her story is not an endorsement of self-treatment, but rather a testament to the importance of rigorous scientific research and the potential of oncolytic virotherapy. It underscores the need for professional oversight in medical treatments. Dr. Halassy's experience highlights the need for continued research and development in this field. Ongoing studies and trials are essential to fully understand and harness the power of this therapy. While her story is inspiring, it's crucial to seek professional medical advice and treatment for any medical condition, especially something as serious as cancer. Always consult with healthcare professionals to determine the best course of action. Please like the video and subscribe to our channel.